And good afternoon, everyone. I'm Anne McBride. I'm the Vice President of Programs at the James Beard Foundation. And I wanted to tell you a little bit about what we're doing for the industry in relation to the topic of this wonderful webinar today around Hospitality Benefits 2.0, Pioneering the Future of Well-Being. What we've heard over and over from so many of you from a policy perspective is the importance of better programs and better legislation around healthcare and mental health support for the industry around other benefits programs. So we developed, after a Chef Action Summit that we held in January, reflecting industry priorities, we developed our first ever policy agenda, and I'll put a link here for anyone who wants to look at it. And we released this in September, our policy agenda reflecting the priorities for which the foundation itself will be advocating. And in the realms of benefit, that includes better access to healthcare for our industry, as well as better access to mental health care, two really crucial elements. So while we are working on the legislative elements of it, we are so thrilled that programs like those offered by Oyster Sunday exist to make benefits more accessible for the industry. And we've partnered before with Elizabeth Tilton on her team, and it's just so wonderful to be able to do this again. So I'm going to now pass it on to Megan Storms, our Associate Director of Women's Leadership Program, and thank you so much for participating today.
Thank you, Anne. So hi, everyone. As Anne mentioned, I'm the Associate Director of Women's Leadership Programs at JBF. I'm going to be on today's webinar to introduce the Oyster Sunday team and help facilitate the Q&A portion of this webinar. So today we are joined by Elizabeth Tilton, who is the founder and CEO of Oyster Sunday and OS Benefits, and Nora Davis, the head of product for OS Benefits. Elizabeth will lead us through a presentation on the landscape of benefits and the future of well-being in the hospitality industry. And Nora is here also to help answer questions about OS Benefits and the product and platform. So thank you both so much for being here. A few things, a bit of housekeeping. Please use the chat function to share questions throughout the presentation. We received tons of wonderful questions pre-webinar, but there will also be an opportunity to ask questions live as Elizabeth goes through her presentation. I will collect those questions and circulate and circle back once we get to that portion of the webinar. This webinar is also being recorded and will be added to our virtual education library. We'll share the link to that, which has other resources for you and your business, including this wonderful session today. So for a brief introduction before I hand it off to you, Elizabeth, as I mentioned, Elizabeth Tilton is the founder and CEO of Oyster Sunday and OS Benefits. Elizabeth's hospitality career started with several years of back of house experience in New Orleans and eventually in New York City to join Momofuku. On the branding team, Elizabeth managed the public relations and marketing for Momofuku's New York restaurants, market research for Momofuku's expansion in the US, and major partnerships with companies such as the World Bank, Sweetgreen, Patagonia, Lucky Peach, plus MAD in Copenhagen. Prior to launching Oyster Sunday in 2019, Elizabeth was part of the original leadership team and head of brand at WNP, a vertically integrated design and manufacturing company, developing culinary products. Elizabeth managed a department to strategize and execute the launch of 300 plus products, including products in partnership with Williams-Sonoma, West Elm, Lucasfilms, and Food 52. Elizabeth and Nora, we're so glad you're here with us today. I'll pass it over to you, Elizabeth, to take us through the presentation, and we'll circle back towards the end for some questions.
Great. Hi, everyone. Thank you so much for being here. I know it's 5 p.m. on East Coast, and I'm actually, funny enough, I live in New Orleans, but I'm here in the James Beard Foundation office today in New York City. So it's really great to be channeling in from here and actually on premise. Without further ado, we got a lot to get through, so I'm going to jump straight in. Again, today we're talking about hospitality, what I'm calling 2.0. There's been some amazing innovation going on in the future of well-being in this industry. I think was laid out to bear during COVID of what was necessary for us to move forward. I'm excited and really honored to be here to talk to you today. So please throw in questions. We'll try to address as many as we can, but without further ado, let's get started. Today's discussion, we are going to be talking really about the changing landscape of hospitality benefits. I think that's really important to start off with. And then we're going to go into OS benefits that we have launched, that we had been working on for several years and have launched launched in September, which I'm really excited to show you about. And then we'll go into physical and mental health initiatives, followed by career development. We think that's a really important part of benefits. And we talk about benefits in terms of more traditional and fringe to get into, but I think compensation is a key part of that. And then we'll go into a glimpse of the future. I always love thinking about what's happening in 24 and beyond, so I can't help myself, but we'll get into that. But let's keep going. So let me start off by addressing who we are and what we do. First and foremost, Oyster Sunday. What we are, we launched in 2019. What we really consider ourselves is to be as a hospitality studio and a corporate office for independent businesses. And what that means to us is that we provide, when I think about being in a big restaurant group such as Momofuku or other ones I've worked at, there's all these amazing resources, right? There's finance, operations, HR, marketing, branding that are really servicing all their brick and mortars. But in my opinion, there was no reason why we couldn't spin that out and serve the over 400,000 independent restaurants across the nation. We do that by really providing, hotels, bars, CPG brands with these services, and really bring the collective bargaining on behalf of these brands to give them really a sustainable infrastructure to build off of. So that's the crux of what we do on a daily basis. And really what spun out of that, hearing what our operators needed and really knowing that, I guess it's important to address that I was pre-med at the University of Virginia, and I have always been a huge advocate of healthcare in this industry, having been a cook and having to navigate that myself. And so what we built over the course of the last couple of years is OS Benefits. I'm going to go briefly over this now because I'm going to deep dive into it, as we mentioned in our second portion of this presentation. But really what it is, it's the first marketplace for independent hospitality to service their teams with preventative care, crisis services, continuing education, family planning and services, and a lot of different, over 25 vendors on a marketplace, and you can add on healthcare. So we'll dive into that. The marketplace itself starts at $35, but I think the most important part of the benefits program is this is built for and by the industry. Like, it's built by us who've been listening to hundreds of restaurants over the course of since launching in 2019. And this was meant to address everything we were listening to and build a product to really resolve issues that we were hearing. So let's jump in. Honestly, to say a changing landscape, I think it's like cataclysmic shifting would probably be the word I would use. And I want to first address like where we are now in order to really think about where we're going. So let's start with where the present looks like. There was a very wise woman in my life, aka my mother, who once told me that there's 3 things you can get from employment and from a job. It's compensation, it's time, and respect. Everything that we do as employers on behalf of our employees are always in service of these 3 factors. In a lot of employment, you're always striving to get all 3. You usually can get 2 in a good job, 3 in a great job. And when you get to 1 or none, people start to jump ship. Or they're trying to look and evolve into other employment opportunities. I think that's really important to recognize as we go into this conversation, and why I brought compensation, because a lot of benefits are really addressing the respect of a human being and the time in which you're allocated, but compensation is part of that. So we'll go into some compensation models that I think are evolving. But I think this is like really, for me, it's like everything stems from these 3 components that we'll talk about. So when we go from responsibility of employment, we go into responsibility of care. This is something that I've really thought a lot about, particularly in the wake of COVID, is that when you look at this graph on the right, it was displayed on social media in like March of 2020. And it really struck to me of saying all these other countries are giving healthcare. And for the United States, healthcare is contingent on employment. So when the pandemic happened, furloughs and layoffs began, millions were laid off. And then as a result, their healthcare is contingent on their employment. And it's really interesting to kind of dive in on the deeper side. The employment and healthcare is really a post-World War way. It used to be used as an incentive in which to recruit. And now on the flip side, as we go into 2024, we have to, being so contingent on each other, when we talk about public and private markets of healthcare, it's just important to recognize the United States does it very differently. And I would like to also state that puts a lot of burden on small businesses, particularly ones of restaurants, and to kind of this, where it's not only an issue of care at this point, it's an issue of recruitment and retention in this industry. Most of us are around 40 average team sizes. And it's not until the 50 full-time equivalent as deemed that you become state and federal mandated healthcare kicks in. And on top of that, we have over 400,000 independent restaurants. It was about 420 before the pandemic. I'm waiting to see an additional survey of how many are out there now. And only 32% of our employers offer healthcare. On top of that, a smaller cohort of even who are offered or participating. I'm sure many operators, I looked at the roster before, and there's a lot of owner operators on this call, and even the most well-meaning operators who provide small business insurance, they're still having enormous issues with participation. So we know that 7.5 million people in this industry do not even have employer-sponsored healthcare, not to mention that there's probably a bigger delta between those who have it and those who don't, or underinsured because of participation. And not to mention that there's 11 million of us in this industry. So it's an enormous population. And in New Orleans is a really interesting tidbit. And where I live, 1 in every 8 persons in the city of New Orleans are in hospitality. So then let's dive deeper. We understand this is a big issue. We understand there's enormous need to fill this gap. And I think that the biggest thing too is there's 3 different types of benefits, right? There's traditional benefits, which I'll dive deeper into. There's fringe benefits, which is a kind of a more industry term, which means anything that is taxable income. So traditional benefits are like not taxable income. It's seen as healthcare benefits, things of that nature. So it's classified separately. Fringe benefits, such as if you wanted to reimburse for continuing education, you want to reimburse for R&D and eating out, those are all fringe benefits that are actually seen as income. And then there's compensation models, which again, as mentioned earlier, is something I'd like to tap into, even if only briefly. So let's dive into traditional. Traditional benefits really means medical, dental, and vision. That's what people associate with. Then we get into, and I'll come back to that in a second, we get into life insurance, disability, retirement plans, PTO, and then family leave. A lot of people, actually, let me go back to the top. In medical and dental, there's small business healthcare plans. Really, that is the traditional large group plans, such as United Healthcare, Blue Cross Blue Shield, Aetna, to name only 3 of the pretty much major 5 players in the market. Then we get into PEOs. So people are probably familiar with things like ADP, JustWorks. Those are basically what they're doing is they're taking a conglomerate of many companies, taking them on as employees, and then servicing them with economy of scale. I would say a lighter version of that would be things like associations. So that's something else we can talk about offline at a different time. Then we get into minimum essential coverage. So MIC plans, as they say, and as an acronym. These are very interesting because they're basically a stopgap between your small business plans, and they're almost like a very high deductible, low principal, but allows some coverage, but there's a lot of limitations to coverage. And then we get into qualified small employer health reimbursement arrangement, which is part of the ACA, kind of came into vogue and kind of came established. And that's the longest acronym. It's very long. I can never remember the full acronym, but the most important part of that is saying, when you're kind of falling under that 50 full-time equivalent, you have the ability of providing a reimbursement to your employees that is seen as a traditional benefit and AKA with tax implications. So again, for the sake of this conversation, I'm going to continue to move forward, but we're happy anytime to talk about. As we're going down this list, I wanted to call out 2 particular things, particularly with retirement benefits. One thing you'll notice, particularly in states like Maryland and soon to be New York, it's becoming state requirement to provide retirement plans and 401k plans. So I think that this is something, although started in these 2 states, and again, it is official in Maryland and is rolling out in New York, you're going to see more of these evolving where people are trying to figure out in the long run, how do we make people have income later in their lives? And I think if you're thinking about what plans you can do and what kind of benefits you can have for your team, there's ways to match, there's ways just to put away that cash on behalf and in their paycheck. So just know that this is going to become a state requirement in states that are looking to that. And then also family, paternity, maternity, and adoption leave. We're seeing that a lot of these leaves are extending. They're well beyond 12 weeks. Some people don't even, there's 4, 8, 12 weeks. We're seeing that people are having more flexible as into that 16-week where they're doing part-time, kind of reacclimating into their business. We're seeing a lot more equal between maternity and paternity leave and time off. And we're also seeing adoption leave as an option, particularly as family planning is changing. So if we're going to burrow a little bit further, a lot of questions are around medical health care and how things are affordable. I'm going to quickly graze over the difference between the public market and the private market. And also we'll get into more about affordable healthcare throughout the course of this presentation. But I think when we're talking about public market, the things that come first to mind are the ACA, or the Affordable Care Act, that was initiated in 2010. And it really impacted a lot of legislation and requirements now across private and public sector. But that was from 2010. We have the Medicaid, which is usually you need depending on state, there's different requirements per state, but usually it's annual income between $16,000 and $20,000. A lot of our team, particularly those who maybe not opting in to our own healthcare plans because of for many different reasons, they actually do qualify for Medicaid. It's kind of an unknown. So if you ever want to talk to us about that and how that can work for your employees, particularly with some reimbursement initiatives, please feel free to reach out. Then we get into state plans. I know DC has a really robust one. People are opting into state plans with reimbursement to be able to offset, knowing that kind of obtaining that private market, which we'll get to, is really hard. And then we have things like child health insurance plans, or CHIP. But again, we'll graze over that today. As we get into the private market, really there's just about 5 key national carriers. You'll hear things, as I mentioned earlier, Aetna, Blue Cross Blue Shield, United Healthcare, and so on. There's basically 3 categories of private market plans you can obtain. The ways these are listed, I say there's an inverse correlation between your premium and your deductible, more or less, if you're to make it, simplify it. Your premium is the amount of money you pay per month per employee, which in states like New Orleans, or in states like Louisiana, I pay around $450 to $500 per employee per month, not including dependents. And in states like New York, you're talking $900. So it really is state dependent. These are, and when you get into a high premium and a low deductible, those plans tend to be more desirable for employees, but they put an enormous burden on the employer. The vice versa, there are things like the MIC, which is more of that kind of our bronze leveled private market plans that are low premiums to the employer and very high deductibles. The reason why I bring this up, particularly in the context of this conversation, is that when it comes down to the burden of care, there's a lot of ways you can cut and dice it. There's a way to make access, but if care is not accessible, both because of your bottom line for the premium and or the deductible to receive care, we're really at a disadvantage to be able to protect our teams. So the one thing that we're really cognizant of is saying, okay, there's a lot of ways you can cut and dice the public, private, all of these things we talked about today. And I think that it's not only a strain on the individual and on the employer, it's also becoming a strain on hospital systems. So we're at this really kind of crossroads, as not necessarily in hospitality, but as an insurance industry and as in healthcare period, that a lot of innovation is happening. So I think it's setting up a roadmap for thinking about how healthcare, there's traditional healthcare and how it's been done in the past, but I think we need to be cognizant of the fact that it's changing and evolving. Then we get into fringe benefits. So this is the next version. This is more things like gym membership, transit stipends, family planning, things as like childcare, elderly care, childhood education, pet walking, things of that nature, continuing education. We've seen a really amazing opportunities such as finance and operations transparency, basically means of ways that people can learn more, scholarships, on-premise, cross-training. So these are things that are low cost to the business, but allows you to invest in people and to give them opportunities to build skill sets that are meaningful. They take time to set up, but once you have that rubric and you have that system, it becomes a really meaningful way to invest in your team. Compensation models. During COVID actually talked a fair bit about compensation models, and I'm really fascinated by them because I think that there's a lot of ways to cut and dice it, but moving people from hourly to salary to get some benefits as being a salaried employee and a W-2, performance-based bonuses, profit share models, equity stake. We talked about ESOPs, which are ways of which to get your entire group to own, or co-ops, managing partnerships and referral programs. These are all a very quick way of saying there's ways of having your salary, and there's other ways of having benchmarking and initiatives to get people to have other ways of receiving being cognizant of the business objectives and receiving additional compensation as a result of meeting those benchmarks. And basically it's a rising tide lifts all ships. So again, for the sake of this conversation, we're going to graze over these, but I wanted to put these here because there's so many unique ways of really making investments in your team and also having financial implications for them by having been part of this journey with you. Referral programs are pretty cool too, because they're also ways of getting great talent and teams and things of that nature. Let's dive into OS benefits. We have, as you know, the majority of our hospitality professionals do not have access to quality benefits, and at OS benefits, it's our mission to change that. So OS benefits, as mentioned, is the first digital marketplace that connects your team with meaningful benefits across multiple categories. What we're basically doing is we're bringing the collective bargaining power of a large group to small businesses. We do this also with Oyster Sunday. It's coming from the same root where we're sitting here saying, okay, not every operator needs a CMO or a CFO, but they need 10% of their time. What if we took that same principle and put that into a marketplace where we're giving free and reduced rate goods and services that have been pre-negotiated, and we did like the legwork to get these onto this marketplace and provided them to your team. So these are the 6 categories that we've kind of tackled. And again, it takes everything from telehealth, dental. We have Plan B that ships nationwide for free, women's health, fertility monitoring, continuing education, dog walking, childcare, elderly care, things I've mentioned in these previous slides. We did a big analysis and adapted that into what we built this marketplace. We have 2 plans, our Essential Plan, which is the marketplace, and Essential Plus that will be coming out in 2024 that allows us to do reimbursement and a lot of allowances from the employer to the employee. So it's really addressing the fact if you're going to be doing more offsetting costs to the employer and to the employee if you're not able to acquire small business healthcare plans, this is a really great opportunity to operate within this. Additionally, on top of our what we call fringe benefits, which are in the Essential Plan, we have secured healthcare coverage, supplemental insurance, which will be launching tomorrow. It covers over 13,000 conditions. So this includes appendicitis, torn Achilles heel, kidney stones, cancer, pneumonia. So things that are very acute that people and then become chronic, I should say. And what it is, it allows every line item gets reimbursed to your team when they have supplemental. So this is really remarkable for underinsured and uninsured populations. We then go into catastrophic. Catastrophic is much more, they call in the industry AD&D, accidental death and dismemberment. And this is what it allows us to do is for a very small sum under $15, we're able to do catastrophic insurance that has any sort of accident. So imagine someone is on their bike, they trip, they need stitches, they break an arm. You have this really remarkable coverage for them that may be, and it's also populations that may have not opted into your healthcare plan. So again, these first 2 categories are really trying to bridge the gap for those who may not have the opportunity or the means to be able to opt into a small business insurance plan. Then we get into healthcare brokers. We have healthcare brokers that are able to negotiate plans on behalf of our small businesses that are really understand what these small businesses need. So our healthcare brokers are able to adapt, get your survey of your population, and then go out and secure plans for you within 5 days. And then we're able to then go into negotiation. You can make informed decisions about the plan that you need for your business. So that's a very brief overview. Again, I would love to talk to any of you about this. I'll give my email at the end. So please feel free to reach out. We're going to go into mental and physical wellness. For knowing that mental wellness is enormous, I went ahead and make the primary point of this slide about mental health. We know, like, one thing that was very much laid out to bear during COVID is that our teams had to choose between compensation and their health, which are completely at odds. And I think organizations like Southern Smoke Foundation with their Grant Behind You program, we help NOLA in the city of New Orleans, Not 9 to 5, which I know the James Beard Foundation has a great relationship with, and other, this enormous list of resources and organizations have provided meaningful mental health resources, particularly most of these are completely free. So as you're considering ways that you're talking about benefits to your team and taking care of them, These are at your, I'll circulate these slides so you have these available to you, but there's so many amazing resources out there. And I think sometimes the hardest part is consolidating them into a meaningful way for your team to digest them, not to be looking for them. So we hope that this is a really great aid for you to be able to circulate those for your team. Next, we're going to go into the kind of career development. The reason why we brought this up about retention is that we know that benefits and compensation is a gateway into recruitment. But once they come into your doors, there has to be a really meaningful way of retaining your teams. As we know in 2021, when doors started reopening, it was very hard to recruit and retain talent across the industry. We have the pleasure of working with operators coast to coast. And a lot of work that we do with our operators is thinking about career development, everything starting from job description till the entire life cycle of your team members. And that the reason we do that is because goal setting and retention go hand in hand. So what I'm going to go ahead and talk about here is like what you're doing, why it matters, and why we set goals, and then go into two different methods of way in which you probably have seen SMART goals and OKRs. Today, we're going to deep dive into the OKR section. It's something that we actually use at Oyster Sunday as well, and OS benefits, because we find it to be a very meaningful and tactile way in which to create meaningful kind of forward-thinking trajectory for our teams. So why it matters generally is it really is about growth of your business and retention of your team. When someone has something to look forward to and to empower, particularly in restaurants, when there's a lot of repetition, a lot of SOPs that we build, and building towards benchmarking and thinking like goals and initiatives, it really helps our team to feel inspired coming in every day, to make it kind of a loose statement. And I think that really comes down to your visions and mission. And a lot of restaurants we work with, we always say it's restaurants with a point of view. What that means to us is that they have a clear sense of self, and every day they show up and try to execute what that means to them. And they're doing that through the food as their medium, and their four walls is the context in which they can build that in. We're learning alternative revenue streams are allowing that to extend with like CPG products and so on, but it's always in service of that vision and mission. And it matters because if we're able to secure and understand who we are as our own brand, we're able to then also create actionable and clear goals for our team to step up and to really be able to go and advocate for the brand, the business, and show up on the floor with the same, what I always call the North Star or vantage point. And I think that's like enormously important from everything from in every line of work in your business, from part-time all the way up to managers and front of house, back of house, doesn't matter. And also really as more restaurants work with third parties, I think it's also important for them to understand your vision and goals, to clarify why they're talking about the brand and how they're representing it. And then why it matters, it drives business success, like it really does. And it also provides transparency to your employees about what success means to you. Because if they're all rowing in the same direction, it makes a huge difference to know that every day they're showing up with the same vantage point. And then also creates accountability, particularly when it comes to review processes, which we really highly recommend establishing in your business. And less than saying, where have they met their benchmarks, or have they really had it holding them accountable to some of the responsibilities, knowing that is for the betterment of their skills and development as an employee. And then finally, it refines the mission and vision of the company, that I've already alluded to. We have two different types, SMART goals, which are specific, measurable, achievable, relative, and time-bound. It's a really great way of creating per department different goals for your team. At Oyster Sunday, we tend to gravitate towards OKRs. The reason is that it allows to create objectives for the entire company, and then each department is able to create key results that they think will be in service of that objective. For example, we want to keep our labor at X%. We want to increase our beverage sales by Y%. These are things that every single department can choose. So from procurement all the way down to your team, to your back of house. So let's use the wine, for example. Really talking to the team about wine sales, talking to the back of house about wine pairings and menu development, all the way out to procurement and inventory management. All that impacts it to the same North Star, and you can create measurable and key results as a result. To be repetitive and use result. Best practices, it's really best implemented where you have annual objectives and you do key results are pretty much like monthly, quarterly, that are really confined times in short term. It allows you to kind of reevaluate them and to go back and say, are these results working? Are they achievable? And can we address them for the next quarter? So you're not looking a full year out. They're also really great for transparency and visibility. We've learned that a lot of team, they want to invest in this. Like they're joining you. They choose to show up every day to be part of your team, which is like, what a gift. Let's like acknowledge that immediately. And I think the more transparency and visibility you can give to the company, it's more buy-in. It really roots them into what your mission is, for what you see your business growing into. And it really is, it's best implemented on an individual level. It's allocating these key results and being like, hi, Beth and hi, Mark, these are your responsibilities now to shepherd on for the next month or quarter. It gives people accountability, which I think can be really powerful, both all the way from management to more hourly or part-time employment. These are just some examples of goals such as operations efficiency, customer service, staff development on the ops side. In the finance goals, we're talking about profitability and labor. And then in brand, we're talking about storytelling, brand imagery. These are all just small nuggets that you can make objectives around, just as a starter. But again, if there's any questions, please feel free to reach out and we'd be happy to walk you through that process and create those going, particularly as we go into 2024. And then again, why it matters. I think this is really, it's about visibility. And I think the one thing I'll take away from this slide that's most important, it starts from day one. Your onboarding and the amount of time you spend to onboarding and to really investing in people's coming into your business and setting expectations cannot be like more stressed. And I know it takes time and resources, but if you can set a precedent from day one, going into the onboarding and training, and also it empowers your team to help with training and the onboarding process, it reinforces it on every part of your business, from those who are already employees to those coming in to join the team. So we have about, I'm going to leave a lot of room for time for questions because we have a fair bit. But let's go ahead and go to the crystal ball and glimpse into the future of what we think well-being landscape will look like for this industry. So I have 6 different categories. I'm going to focus mostly on the left side of the slide, starting with telehealth and accessing care. We've had a really amazing opportunity to talk to a lot of heads of innovation for hospital systems, particularly in the state of Louisiana. And telehealth is here to stay. It's becoming an accessible way for people to receive care, particularly for maybe not more acute and catastrophic needs, but more acute, long-term, moderate conditions and chronic care. We're seeing that as being adapted. There's a lot of hospital systems that are prioritizing telehealth as a way to bridge. So such as if you're getting labs, you can talk to your doctor via telehealth versus going in person. We're also seeing it as really amazing accessibility for restaurants that maybe not be in concentrated urban spaces, maybe more in secondary or tertiary markets that have access to specialty and primary care or PCPs in big urban settings. So telehealth is going to be enormous going into 2024, and a lot of hospital systems are double down as a revenue stream for their businesses. In terms of hospital systems, insurance carriers, I alluded to this earlier in the presentation. When it comes to hospital system insurance, at the end of the day, hospital systems are businesses. They're looking for profitability, and with keeping keeping the best Hippocratic oath in mind and taking care of their patients. But at the end of the day, the bottom line matters. And insurance carriers are the same way. But at the end of the day, when you have patient, insurance carriers, a bunch of third-party tech platforms, and hospital systems, there's so much being integrated. I think we feel the same way when it comes to technology and restaurants. There's so much coming into the pipeline that a lot of these margins are being squeezed. And additionally, the cost of care is increasing. And the cost of food is increasing. Our bottom lines, our profit margins are decreasing. We're trying to figure out innovative ways of thinking about labor and service, and all the way down to hospital systems are doing the same thing. A lot of hospital systems are also now doing direct to patient care. Things like telehealth have bridged the gap for that. They're basically bypassing major insurance carriers, are looking at more adaptive, innovative insurance, I'll say insurance in quotes, but not traditional insurance, but much more of the telehealth, the membership models. Some PCPs or primary care physicians are brokering directly with patients and going around insurance and having membership models. It's all being shaken up right now. And I think that's why things like OS benefits are coming at the right time to really sit there and say, if this is all shaking up, like, let's be part of that narrative and like go out on behalf of this industry to go and negotiate innovative ways that we can bridge the gap to care. And I think too, when we're talking about large insurance carriers and PEOs and associations, this kind of touches on that. Like, a lot of small businesses are going to PEOs and associations, which are really changing up the model of how people receive and negotiate small business insurance. So I would just keep an eye out for that. There's going to be, I think, a lot of change, particularly on the association side. I think we would be remiss not to talk about the rising cost of operations of restaurants. Where food cost is going up. The consumer is getting more informed. Our margins are getting slimmer. Our technology is getting more expensive. All of these things are happening. And at the same time, our teams are asking to be taken care of more, and as rightfully so. And I think that these things are, as an owner operator, I would say I'm going to make the assumption that the vast majority of operators inherently want to take care of their teams, but as margins get tighter, it becomes more difficult, and we just have to recognize that. And so I think that the reason I bring up rising costs is that there's so many innovative ways, and something Megan and I talked about before this webinar is like, what do you prioritize, right? If you have all these benefits people are asking for, maybe you can't do a 401k match, but you can do staging, and you can do innovative ways to invest in continuing education that gives them skill sets to continue in their business, or to promote them, or to have different mechanisms of promotion, or bonuses, as we talked about. So I just want to say, like, I want to be empathetic and really address that part, because it's really hard. Like, the operations are really difficult right now. So, bless you all for pushing through it. And I just want to tip the hat of saying, all those owner operators who are on this call now, I know you're trying to invest into this. And, I think the experience, I think the one thing that is here to stay, and was definitely a post-COVID, everyone said, oh, everyone's traveling and going to these experiences over consumer products. It's here to stay. I think we're definitely going to see another year of experiences. So I think as an industry, we're in luck for that. I know that we've talked to a lot of operators that, as we've gone to the fall and gotten out of the summer slump, they're feeling that momentum of people coming and dining and having like PDRs and really expensive bottles of wine, all the way down to just having meals on Tuesdays with their family. So I do think that will be here to stay, as will alternative revenue streams. I've talked a bunch about this during COVID, including with a seminar with the James Beard Foundation. And alternative revenue streams, going back to the rising costs of operations, restaurants are diversifying their revenue streams because it's becoming a really meaningful way to extend beyond your four walls of your business, and or to utilize them in different times in different ways. But it's really important to consider in your business, does it make sense to think about merchandise, CPG, or consumer packaged goods, and food products, or subscription models and things of that nature? They're really meaningful ways to forecast in your business revenue streams. And I think that we're going to give you, and particularly in some times when maybe sales are lighter or labor is higher, they're really great ways of being able to protect your business, and to think about meaningful ways. But these are our projections for 2024, and I'd be really excited to hear your opinions as we go into Q&A. Par for the course, I talk quickly and get through a fair bit. So we'll go ahead, and I would love to open up to questions. I know Nora has also joined me on this, particularly on the product side. She's done oh yeah.
Sorry, just before the Q&A, I don't know if can you all hear me? Okay. What you were just saying in terms of your prediction, Elizabeth, sorry for the plug, but we are releasing we just surveyed the industry, and I'm sure some of the people who are attending this webinar have participated in the survey, and we'll be releasing our industry report with reflections on 23, projections for 24 on December 5th. So you'll all receive that resource. But so it's really fascinating to see your trends there. And we'll make sure to also incorporate that in our thinking around it.
I'm so excited to read that. That's awesome. I love trend
and
reporting.
It's very much on par with what we've seen in the survey results already. So you are so on point.
Ah, that's so great to hear. Thank you. There's a really good, just speaking of forecasting, I love those. This is the time of year where a lot of those forecasting reports, and they're so fascinating. I have one from back in 2019 going into 2020, and I've held on to it just thinking about how much the world has shifted. So it's fascinating. Thank you for that.
Well, as I mentioned, we received really great questions in advance of the call, advance of this webinar. So we'll start with some of those, but I encourage everyone to still use the chat and ask further questions after hearing Elizabeth's presentation. And Elizabeth, I know you covered a lot. So, and a lot actually of these questions were covered in your presentation. So I'm not going to read them all, but I'll start with maybe some other ones that were not necessarily that were covered, but want to go in depth about.
Sure.
So I guess you mentioned that retirement benefits are beginning to be required by law in certain states. Are there other benefits you're seeing or that are required by law or that you think might head in that direction eventually that employers should be aware of?
The only other thing that that's a great question. I would say retirement is definitely the one that I've seen that's been mandated. That's very fascinating. I think there's certain states like New York and Washington that have made really simple for mat and paternity leave and adoption leave that they're doing reimbursements back to the employer to give more leave to their members of their team. I think that is a resource to definitely tap into as a small business. I think that's really fascinating. I haven't seen as much mandate. It's really kind of that 50 full-time equivalent of employer and in every state. And I'm using it as a generalization. Every state is a little bit different, but usually the federal is at 50. But those two are the only ones I've seen. I would love if anyone else in the chat have seen more. It'd be great. I would love your feedback. Because we see most of the states, but not all of them. So let me know. And also too, if you don't mind, people in the chat, not to bombard you, Megan, as you're reading through these, if you can tell us where like some benefits that you have and that where you're located and which ones you've implemented, I'd be super fascinated to see as a poll in the chat here. So if you don't mind populating some, it would be great for us to read them. I should have started with that, giving you more time.
We'll keep an eye out. So yeah, please use the chat. All participants will look out for that and we can organize it as we continue. Another question that we received before the webinar was, are there any tax incentives in providing education assistance for employees? And I'll also add on any other benefits. Is there any tax incentives with providing benefits for your team?
I would highly recommend talking to a CPA. I'll clarify immediately. I am not a tax expert. I'm not a CPA, and every state's a little bit different. There definitely are. I don't think I could speak to you in detail in broad strokes, but I know there's also certain things like I'll speak to the state of Louisiana. There's certain incentives for employing certain types of members of your team. For example, they have a state of Louisiana, there's an enormous amount of tech innovation and people are looking for developers and things like that. And there's tax incentives for employees if you hire them in the state of Louisiana. So it goes all the way from recruitment down to employee benefits. So I would just highly recommend, we can talk about it again offline on a one-off basis, but when we have like great CPAs to cast that net, but there definitely are tax incentives and every state's very innovative about how they prioritize their economic development relative to what they're investing and prioritizing for tax. So it's just such a good question. I wish I could be more specific, but we will definitely do our due diligence to see if we can come up with some more.
Okay, wonderful. Another question is, do you recommend that a business has some sort of cash reserve on hand when exploring benefits and attempting, and wanting to introduce them to their business?
That's such a good one. Yes, 100%. I think particularly because when you think about the same way with labor, your benefits are part of your fixed cost at that point, and they're not going to change even if your revenue does. I would highly recommend having a cash reserve. I know during the pandemic, there was a lot of people who did wellness charges, surcharges, things of that nature to reserve that. I would say that the one thing to start with, and I probably should lead with this, is that when you're considering adding benefits to your business, they are expensive. there can be extremely costly. And remember that it's not about the 5 people you have now. It might be about the 50 you have in the future. So whatever precedent you set out for benefits, you want to make sure it's scalable and sustainable. So going back to your financial model and running the numbers and making sure that it's viable for your business, because the last thing you want to do is overextend your budget and to not be able to employ anyone. So 100% cash reserves and running the model and making sure it's sustainable is like super key. It's such a great question. How much is it's really contingent on your cash flow. I think a couple months worth of benefits, let alone payroll, is always best practice. Couple is in like ideally 6 months to a year, but obviously we all fluctuate on very different operating. So people are running 3 months at a time, 1 month at a time, 6 months. But for the sake of adding in benefits, I would definitely allocate that budget.
Okay, thank you. My next question is a combination of a few ones that we received before, but what would you say? So in understanding that people on this call and other business owners want to be employing benefits, traditional and fringe, but might not be able to provide the whole suite that we reviewed in the beginning of this session. What would you say would be like your top what have you seen, trends that you've seen with employees, or what would you say are your top fringe and traditional benefits that you feel like an owner operator should prioritize if they're starting from the ground up?
Yeah, I would say first and foremost, survey your team, ask them. Like there's that, what an amazing way to get anonymous feedback of what people need. I would say overall as an industry, definitely the beyond compensation, knowing that compensation and health are like 1 and 2, a very close third is PTO. I think we've run a lot of models of saying like people, particularly now in this kind of like post-COVID world, is people need time as compensation, and they're seen as synonymous, and particularly in this industry where people want to gain that back. So I can't stress enough of like PTO, adoption, like maternity and paternity leave, having time with family, having time to live and be is really important. There was a really great survey with Cornell that did out in 2021, and that was like top of the medical healthcare, medical vision and dental, and PTO were the front 2 runners. And I think that there's really innovative ways that people can allocate PTO. There's also ways where people close down their whole restaurant for a week or for a certain periods of time, because all of a sudden you're not dealing with labor or inventory. And there's that really meaningful way for everyone to have time off together, that versus trying to and you can run models to figure out what the cost of that to your business. A little inside intel, we're actually working, stay tuned, we're working on a calculator, like kind of a real plug-in calculator to figure out if I were to get PTO, what is the cost to my business per employee and like per group. So we'll be building that out going into 2024. So because we do know it's really important, and it's not represented in our OS benefits platform, but it's crucial.
And would you recommend, and I'm sure this is different for every business, but unlimited PTO, is that a model that you've seen work, or should it be more structured than that?
I think particularly operating restaurants is more structured. I just think it's inevitable. I think that you need to be able to predict, there's 3 things that we can control, right? It's our food cost, our labor, and our G&A or our admin fees. And labor is like an enormous part of your business, particularly in restaurants and service. So I don't think unlimited, I think you can be generous. But I think setting a precedent of what that means is important. I would love to. It's amazing. Let me just say that as well. I just think it's different types of business structures that can make that viable.
So another topic that came up in a few questions was healthcare availability for undocumented workers, and how employers can make each employee, regardless of their status, feel a part of the company, and that their work is impactful and that they're a part of the team.
Yeah. It's so, we talk about traditional and kind of this evolving world of insurance and of care and telehealth. A lot of traditional healthcare is based off of doing a survey, getting your full population, having social security numbers, all that jazz in order to bind. A lot of our telehealth and more, what I'll call it for the sake of this group, a la carte services, that there's a payment up front that is paid per an individual to get telehealth, such as what we have in our essential plan. We have a telehealth provider, and they say, you can come to us for $30 and have a urgent care, dermatology, women's health, any of these prescription refills, and all we need is your name and your email. So I would say that there's a lot of, and I think with the innovation of care, it's opening up the door to receive care for those who may have been otherwise left behind or forgotten in the sense of the insurance companies. So I think that there's going to be a lot more access, and I'm excited to see that because in my opinion, everyone deserves care and it's a fundamental right. And I think that it's going to open up the door. And I think there's other things like catastrophic insurance that you can opt your team into and stuff like that, like or supplemental that we've secured. It still is a huge impact when you have to go to the ER or you have some sort of catastrophic. You're still going to have care in person at some point. Hopefully not. So I just think there's limitations, but I'm hoping that your primary care, more urgent, like really quick telehealth can be obtainable.
Great. Okay. Thank you.
Of course.
Another question, and I also want to encourage participants to use the chat if you have any additional questions that I'm not covering. But my next question is, aside from OS benefits and Oyster Sunday and this amazing webinar, are there any other resources that you would suggest business owners, operators look to for sort of navigating this field of benefits and providing benefits for their team?
Yeah, I'm sure there's some remarkable, more human resources, people and culture, publications and things of that are out there. It's a great question. Maybe we can actually we'll do some due diligence and I can ask our director of people and see what resources she taps into. A lot of what we're doing is talking to owners and operators and reading ravishly about what's going on in the industry. So I think that in terms of centralizing, I think it's all evolving so quickly. I think, yeah, I'll come back with some thoughts. It's a really good one. I think we're just absorbing as much as we can from multiple different, like we're not only just looking at food and beverage, we're looking at technology and doing SWOT analysis of what people like Google are offering their teams and looking at it kind of cross-functionally and cross industry in order to make informed decisions. But I'll definitely make sure when we follow up with these slides, which we're going to be circulating this deck, we'll include additional ones that might be great resources.
And I also just I'm answering my own question, but additionally, JBF resources that are on this topic include the compensation benefits and growth guide that Elizabeth, you participated in, our business innovation models white paper with Deloitte. We'll put all of these links in the chat as well as in this follow-up email. We also have a virtual education library. So that's also a great place to look for additional resources, some webinars we've done with you, Elizabeth, and other around compensation and benefits. But I know I'm not a question, just an additional.
Chow also has some great ones. There's a lot of those mental health resources that we provided. And those organizations do have libraries and resources that are beyond their hotlines and programs. So those are also really great points to start. But yeah, definitely, Megan, thank you for that.
I was just going to jump in to add that a lot of those are also state specific. So really good to look at, especially Chow has done a great job in the Colorado and the Denver area, Giving Kitchen down in Kentucky. So also make sure you're looking for those state specific, because unfortunately they wanted to make this as complicated as possible in the United States for us to get care.
Thank you for that, Nora.
Well, I feel like I covered most of the pre-event questions. Is there any, Elizabeth and Nora, any parting words with the few minutes we have left on this topic? Anything else you'd want to share about OS benefits? More info that would be helpful for this group?
Yeah, I went ahead and provided my personal email. Obviously, I'll get Nora wrapped in as well and make sure that we can answer any questions. I think the biggest thing is that anyone on this call right now is really obviously invested in their teams and want to make an impact. And I think the beauty of it is that these are conversations that are happening as a collective, and having organizations like the James Beard Foundation that has not only committed doing webinars, but have put out resources, I think is a telling sign of where this industry wants to go. And I think people ourselves, I'll speak for Oyster Sunday and OS Benefits, we're listening and we're trying to build and adapt towards what we're hearing people need, because it's loud and clear. I think like companies or organizations like Southern Smoke has like absolutely done a remarkable job with Chris Shepard and all of them done with the grant programs and the mental health resources. And I'm excited to see where this next chapter lies. And I think we're just beginning. And I think that the more you can ask your team, the more you can really crowdsource and like input for impact. And also I cannot encourage you more to like share with each other what you're doing and how much it's costing. The more transparency we have as a collective, the better off we are. We're very transparent with how much things cost. And I always joke that we're a group of pirates out into the ocean, and I really want us to start rowing in the same direction. And I think everyone wants to. We all want to go and like in that right direction of being great employers and making this a hospitality could be a profession and a place in which you want to work for decades. And I think that like the participants on this call today are going to make that possible. So encourage other people to, share this broadly, encourage people to also, reinvest into their companies and into their business. It's going to make its independence or the heartbeat of culinary. And I really believe that. So anything that we can do both in Oyster Sunday and OS benefits to make that viable and possible, like reach out. Love to hear from you.
Well, thank you. Thank you both so much. Thank you for the resource you provide to the industry, including this webinar and the resources I know we'll share post webinar. So